So how do you think that went, Christy?
I think it went okay. I think I screened for everything I needed to screen for. I asked about tobacco, alcohol, other drugs.
No, I think overall you did a nice job. I'm going to talk to you about some of the things that you did well, and then we'll talk about some things, not that you did poorly, but just some other things to work on. Okay? Mm-hmm. So like you said, you did a nice job screening for all 4 substances. We really recommend that. Even before that, you did a nice transition. So you asked him about stressful events, changes in work, then asked him about health habits that might be related to blood pressure. So it was nice how you kind of tied that into his medical problem, so it's more kind of personal for him rather than just kind of talking generic. Sure. It's always best if you can do that. You did a nice job kind of giving him information about alcohol in a pretty simplified way that he could understand some of the health effects that it can have. Clearly by the end you had him thinking about some of those effects. Mm-hmm. You kind of gave him a recommendation, which is always good to kind of give your kind of medical opinion of what you think would be good for him to do. So the next thing to work on would be to kind of involve him more in coming up with a plan or a goal. Okay. So you kind of told him this is what you should do to cut down on your drinking, and for some people that'll work just fine. But he seemed a little bit reluctant, so it might be best to kind of ask him what he thinks might work, and to kind of involve him a little more in that, coming up with a short-term goal and a plan. Okay. But it was still good how you were able to at least tell him. And again, he was thinking about it, but he was still seemed a little bit reluctant. So to involve him a little bit more would be helpful. You did a nice job of also affirming with him. We teach you about using affirmations. So how you congratulated him on doing well with not smoking anymore and things like that. So that's good. Not misusing prescription drugs. One thing also that I would recommend is when he told you about that he probably still has a bottle of old Percocet in his medicine cabinet, talking to him about the safety issues around that and really that they need to be disposed of, especially if he is drinking more and say he would injure himself, decide to take some of his pain medicine without going to see a doctor. Could be dangerous. So to talk to him about that as well. But like I said, I think you did a good job with the screening questions, giving him advice, giving him some nice affirmations. Good. Yeah. No, I think overall that you did a nice job. You did a good job of kind of transitioning, initially talking about kind of less threatening areas than substance use, talking about stress, changes at work. Then you tried to tie health habits that can affect blood pressure, which was a good way to kind of bring that up with him and tie it into his particular health problem. So it's really more personal for him rather than talking about drinking in general. So that was nice how you did that.